The current situation is that we've had a sixth case of meningococcal disease reported at the University of Oregon among students since mid-January. So this case has been confirmed. It is another serogroup B disease. We assume it's related to the additional cases. In addition, the students are about to be headed out to spring break next week, and we're trying to work with students and parents to make sure that the vaccination effort continues.
Can you just talk about the importance of that, the timing of it right now with spring break? And it sounds like not this question, but why might that be important for folks to encourage their students to get vaccinated, maybe if they're, say, leaving the country or going elsewhere across the nation?
Right. Well, first and foremost, I think it presents an opportunity because the students have been on campus, they've been taking classes, and now they have some time off. In addition, a lot of them are going to be going home to their parents, and we're hoping that parents may have more powers of persuasion over their students in order to get those who haven't yet taken advantage of the vaccine to go and get the vaccine. So they should be able to go to their physician or to various pharmacies around the state and get them vaccinated. We really want to enlist parents in that effort to get the unvaccinated students vaccinated.
Do you know how available the vaccine is? I got an email from a woman today whose daughter's actually at OSU rather than U of O. But she said she called Kaiser and they said, well, we don't have any. Do you know how available this is, how common it is?
We've been working with pharmacies around the state, especially with corporate headquarters, to try to make sure that they get the message that the students are going to be out there and that the vaccine will be needed. So I can't speak to every pharmacy, and it may be a good idea to call beforehand to make sure they have it, but we've been working to try to make that happen.
Can you give us an idea of how the sixth student is doing? How he's doing right now?
The sixth student is doing fine in the hospital, conversant, wide awake, doing okay, and expected a full recovery.
And had he gotten his vaccine when you did the mass vaccination clinic on campus?
So we're not going to talk about the specifics of individual cases, partly because we don't know all the details at this time, but also because it's not proper really to talk about the medical care issues if you're not the primary care provider for them.
And he was living off campus. Did he have roommates? And if so, have you contacted them? And how are they doing?
We have worked with the student to identify anybody who would meet criteria for being a close contact, and they've been called and contacted and advised to take antibiotics. The point of the antibiotics is to eliminate the organism from the nose and throat before it can invade into the bloodstream or into the nervous system and cause meningococcal disease. But remember, the people who are close contacts of a case are at elevated risk for a period of time, maybe 2 weeks after they had contact with their case. But we infer that the organism has basically diffused throughout the university campus and that there's going to be a prolonged risk that will last not a couple of weeks but for months for unvaccinated students on the campus. So we think, for the vast majority of students, the real message is get vaccinated. We're not going to solve this problem by giving antibiotics to a few close contacts.
So you actually think there's a potential for a lot more people to come down with this, is that right?
Yes, the way meningococcal disease works is that probably for every person who comes down with illness, there are several hundred people who have been exposed to the organism but who skated through it, whose bodies overcame it. We don't know which ones who encounter it are going to come down with the disease, and that's the reason that we undertake a mass vaccination campaign. Usually meningococcal disease is controlled by surrounding a case with antibiotics, with giving antibiotics to the close contacts of a case. But when you see them popping up apparently sporadically on a campus like this, we infer that the organism has already escaped that initial ring and gotten into the broader student population.
So the fifth case last week, I believe, the student lived off campus at the 13th and all of this huge apartment complex. Is that the sixth case lived there as well? Can you tell me?
Sixth place did not live there.
Did not live there. Wasn't a fraternity by chance?
He was affiliated one, but not a living on campus type of a fraternity. Fraternity without a facility.
Because according to these students, they seem to think that at least all the cases so far were in Greek life in some aspect. I don't know if you guys know that or not, or can comment on that.
So I'm not hearing that in Lane County, that the students are sensing that. Perhaps you are from some of the persons you've spoken to. We have 3 of the 6 who have an affiliation with a Greek system facility, so roughly half. And that's all, not all 6, certainly.
Is there a concern, and correct me if I'm wrong, but is there a concern that somebody who may be carrying this travels somewhere else, they don't have the symptoms yet, but then they develop symptoms and then get other people ill in different areas of the country? Regarding spring break, is that a concern?
No, that's not my big concern. My main concern is for that person who may be walking away from the University of Oregon campus recently exposed to the bacterium, and then if they're unvaccinated, be susceptible to the disease. But generally, contacts of contacts, if you will, their connection is remote enough that we don't see elevated rates of disease, and we don't recommend that any extraordinary measures be undertaken.
This makes me wonder a little bit about parents who are going to be sending their kids off to college for the first time next year. Should they all be considering getting their students vaccinated no matter what college they're going to?
That's a good question. In general, though, I want to point out that meningococcal disease has become pretty uncommon. The case rates have declined for about 20 years now in the United States. We had only 4 cases of serogroup B meningococcal disease in all of Oregon in all of last year. So, the general rate is low. Now, what's going on the University of Oregon campus has been sort of extraordinary. We've had, a large number of cases, 6 within a relatively short period of time, and that suggests that something unusual is going on, and we take action there. But I don't know that kind of mass vaccination recommendation is warranted, for all colleges at all times, because one of them might once in a while be hit like this. You know that it's happened at Princeton, at UC Santa Barbara, but there are a lot of places where it hasn't happened. Moreover, we don't know how long the immunity from the vaccination is going to last. There's just too many questions right now for us to make a general recommendation for college students.
Right now, the university has said that they're only focusing on undergrads, but now that you say that there could be a prolonged risk, do you think the university will be switching and County Public Health will be stepping in to make sure that all staff and all students, graduate students, are also vaccinated?
So undergrad was the largest risk group, but others were also involved in our recommendation for vaccination. That included graduate students, for example, who lived on campus. So that was a smaller group, certainly, but they have been involved since the start with our recommendations. The university is in deliberations on what they're going to do going forward, and we won't speak for them, but certainly they're talking about what their plans will be for the fall semester.
What's your message to students who don't think they need to get this vaccine? I was on the campus yesterday, and probably half the kids I talked to said they're not even worried about it. They don't plan to get their vaccine. How alarming is that to you?
Yeah, that's what concerns me, because I think they are at risk. I think the organism, as far as we know, has diffused through the undergraduate population on campus. Kids at that age especially are at some risk for meningococcal disease, and it wouldn't surprise me to see more cases knowing that there's a lot of unvaccinated students remaining. That's the message that I want to get to parents across the country, and if they can, persuade their kids during spring break to go in and get vaccinated, by all means, please do it.
And in my messaging in the county, in Lane County, I talk a great deal not only about what we've experienced so far. So we've had one person who died and one person with really a life-changing illness. Many illnesses are life-changing, but this was really quite life-changing, on a ventilator for a long period of time, and that's important to know. And it's also important to point out that this is going to be a risk for some time going forward, and we can't predict who it will be that will be affected. And the best way to get your immunity and get protected is get a vaccine. That's the best bullet we have at the present time, and it's available. So we're trying to push that hard.
When compared to other outbreaks of meningococcal disease at universities, we're seeing more cases more frequently? I guess what's your thought on that?
Outbreaks of this serogroup B have not been all that common. There's just been a few instances. I would say it's, at this point, similar. Princeton saw a total of 8 cases, and then they kind of had a 9th one a couple of months after the 8th one. And UC Santa Barbara had 4 cases within a very short period of time, I think all within about a month. And so we've got 6 cases in 2 months now, and it seems in the ballpark of what the other schools had seen.
Has there been any flaws that you can identify in the response from the university and from local officials? Can that be attributed, this going on, or is this very normal?
I guess I think it's normal, more or less, unfortunately, for students not to pay all that much attention to this kind of thing. I don't think it was possible to be on campus during that period of time and not to have heard about the problem. the messages were ubiquitous. So, you know, it's a question of how do we motivate the students to get this shot.
Are there steps beyond what is being done right now with the mass vaccination? If this continued for several months and you had a much larger outbreak, are there potential ways to ramp up the response?
There's a lot of planning going on, as you might imagine, behind the scenes, so to speak. So we've had these two main clinics for those 2 separate weeks, and now we're looking at essentially Plan C, if we had Plan A and B, which would be how do we go to them instead of them sort of coming to us at the Matthew Knight Arena and at the Student Health Center. So we're looking at individual clinics at those sites. We're also looking at always what happens with the next case, what messaging can we do that will work better, what is it that we can do to make sure that we reach people more quickly as part of our contact investigation paradigm. So there's a lot of process improvement as we move forward. And of course there's daily meetings. You know, there's a lot to do in an outbreak like this, and it's pretty complex. So a lot of delivering of separate duties to individual groups of people.
Have you considered asking the university to make it mandatory for students to go and get this? I'm sure there's ways they could do that.
There probably are some ways they could do it, maybe more ways than I'm aware of. Hold their grades or something. You know, I don't want to speculate about that. But on the other hand, you know, there's medical autonomy in our country, and people can decide for the most part what it is they want to do. We make strong recommendations and let people know through education what the risk is to themselves, to their family, and to their community. And each one of those are potentially quantifiable, and we try to share that data. And those are the main forces that we're using now to try to proceed with a successful campaign.
How does the vaccine work? How long does it remain effective? Like if some of these parents have gotten it years ago, would they need to go get a booster shot or just get it all over again? How does that work?
The vaccine is really very new. It was first licensed October 29th, and a second version of it was licensed in January, and there aren't enough data now to say how long it will be effective. We think that if students get the 3 doses that are recommended for the vaccine that's been given on campus primarily, that it will last months to years, but whether it lasts more than 3 years or 5 years, nobody can say yet. There aren't enough data.
And kind of follow up on that question, I understand it's either a 2-dose or a 3-dose regimen for the vaccine, so, and that's spread out over a period of time. So if the student gets the first dose, are they still at risk of contracting this meningococcal disease? They haven't had all their doses?
Yes, there's some risk that remains. With the first dose, a pretty sizable number get antibody levels that we think will be protective, probably 90%, 85, 90%. The second dose is really needed to boost the levels even higher so that your immunity stays longer. And we think that's important in this case because, you know, we don't know how long the risk will persist on campus, but it could be several months.
Do you have an idea of how well it's going? Do you have, for example, half the population inoculated, and what percentage was inoculated beforehand? Kind of, have you got an idea of how you're doing so far?
So we track total numbers, and we track them through not only the clinics that we're running through public health or through the university, but also we get numbers from the pharmacies in town that have the vaccine, and they provide us those daily numbers. So we're approaching 10,000 persons vaccinated that are linked to this particular outbreak site. That total population is 22,000, so we're getting close to halfway there. And that is impressive in and of itself. I mean, that's a huge number of people. When you look at Princeton University, their whole school is less than 5,000 people. So, you know, we're close to double that. That's impressive, but we're not where we want to be.
And you started at 0. I mean, you probably have no idea how to know that, but what do you think you started at?
We did start at 0. Again, it's a new vaccine. This is serogroup B. There was no vaccine, so no one was vaccinated before this campaign at the University of Oregon.
And who's paying for it? Sorry. Who pays for the kids pay for themselves, or it comes under health insurance?
So there is a mix of payment opportunities, mostly through insurance, and most of the students have some form of insurance. There was some free vaccine made available, and there are also a few people paying out of pocket. We're trying to minimize that and make that as close to 0 as possible.
This was part of the work that needed to be done, though. Because the vaccine is so new, the National Advisory Committee on Immunization Practice hadn't even made its recommendations when we had to decide to recommend the vaccine for college students. Insurance companies generally fall in line and pay for vaccines recommended by this National Advisory Committee. So we've been working with them all saying, hey, we've got an extraordinary circumstance going on here. Can you agree to pay for the vaccines? And almost all the insurance companies have agreed to do so, at least, you know, for the University of Oregon students for whom we've recommended it.
Did somebody get sick with this? how long do they have before it takes a really bad turn?
So the incubation period can go out to 10 days, but most people are sick within 3 to 4. And you typically know fairly quickly, day 3, 4, 5, if they're going to get really severe illness. Many people unfortunately get severe illness if they get a full infection with this, as opposed to just being a carrier of the bug. And Paul, you might want to add to that. Once you're infected with it, the bacteria can multiply very, very quickly and can cause, serious disease, as we have seen. And it can be in just a few days.
Yeah, there's some variability to it, and unfortunately the early symptoms are often what we call nonspecific. You feel a little achy, you may have a little temperature. Then, as the disease progresses, the fever will become more insistent, and you could develop a stiff neck or a severe headache or a rash. I would say certainly anybody with a fever plus either a stiff neck or a severe headache or rash ought to be seen promptly.
How much help are you getting, if any, from the Fed, from the CDC? I mean, are you sending them samples that they're checking, seeing whether they're all genetically linked, those 6 cases, or kind of what's going on with the CDC? How much help are you getting?
So there's a variety of levels of help. So you mentioned the laboratory samples first. That's a key part of the chain of this. Typically, we have some testing done locally at a clinic or a hospital, and then that testing is confirmed at the state laboratory, and this is the same in all 50 states. They all have a state laboratory that does this confirmation. And then if further characterization is needed, for example, to link all of these samples together and say it's the exact same strain, not many laboratories have that ability. So we then send those to the CDC, and they provide that for us as well. So for all the samples, we're using all of those labs, local lab, the state lab here in the Portland area, and the CDC lab. And additionally, there's a lot of collaboration around meningitis in general. The meningitis branch at the CDC, of course, worked very hard on the other serogroup B outbreaks in our country, at Santa Barbara and at Princeton. And they have a lot of knowledge, information, on the ground experience that we don't have. So I don't think a day goes by without a call to the CDC, either from the state or from my health department in Layton County. Certainly 3 or 4 times a week just from the county level.
You don't know whether sorry.
And we've been bouncing our proposed recommendations off them the whole time and making sure that we're all in agreement about them.
Do you know yet whether those 6 are linked? Like you can say they're exactly the same strain?
The first 4 have been had molecular testing going on. It's called pulse field gel electrophoresis, where they look at the DNA bands, and the first 4 are definitely linked. I don't know that we've subjected the last 2 to that analysis, but there's not much doubt in my mind, frankly.
In terms of meningococcal disease, this particular B strain, is this, I guess, more dangerous per se than other strains, or does it act more quickly, or does it, how would you differentiate it?
No, I don't know that there are differences between at least the strains that tend to circulate in the United States, which are B, C, Y, and W135. I don't know that there's any clinical difference between those strains. I can tell you that, in Oregon overall, the case fatality rate has been around 7 to 10%. 7 to 10% of people who get it die of it.
Have you any idea why the disease gets a hook into a school? I mean, presumably all the things that students at U of O are doing that's happening at OSU, they're kissing, they're sleeping in dorms and all that kind of stuff. But it gets a hook in the U of O. Why? And why just in Princeton? And why just, any ideas?
You want to speculate on that one, Paul?
No, I don't know. I have no idea.
So again, coming up here in a few days, about 22,000 undergraduates are going to be away from school potentially for a week. And I guess your message to them and their parents moving forward in the next couple of days, what do you want to get out to them right now?
You've got a week off. Go to the pharmacy or go to your doctor and get the vaccine.
Given that it's so new, this vaccine, do you have any concerns about its effectiveness, or are you monitoring that? Anytime you have a new vaccine, I imagine that's part of the protocol.
Yes, it is pretty new. It was licensed based on its ability to generate antibody responses among people. We don't have a lot of data on, how well it actually protects, and certainly how long it protects. I will say, I'm happy to say that at Princeton and at UC Santa Barbara, when they undertook the vaccination campaign, they didn't see any cases after that. At Santa Barbara, they only vaccinated 51% of their population, and they didn't see any more cases after that. Was it luck or was it because of the vaccine? It's hard to say, but we think the vaccine worked because in neither instance did the cases continue.
Can you give us an idea of how the other 4 students are doing, the 4 confirmed cases?
So I can share what's been in the media already. The first case, who had the severe illness and a long period of time on a ventilator and such, is planning to return to school, as I understand it, the next term, which I think starts March 30th, which is pretty remarkable from a standpoint of how ill she was. The other three, as I understand, are still students. They did not have to take much time off. They recovered pretty quickly. I don't have specifics on their medical care. Sorry about that.
And they wouldn't be considered a threat of spreading it again, right? They've already gone through the process.
Correct. Almost certainly they have protective antibody. Again, for how long? Is it for life? We don't know. But certainly now, in this period, they're protected.
So it's been a couple of months now since the outbreak started. The other cases of Princeton and UC Santa Barbara, how long did those go on for?
So Princeton was close to 9 months.
Right, from first to last, it was quite a long time, although I think a bunch of them were clustered together within like a 2-month period. UC Santa Barbara, I believe all of the cases occurred in November of 2013.
So are you confident we're going to see more cases in Oregon?
No, I'm not confident about anything. I think that the population is still at risk. It wouldn't surprise me to see more cases. We've been getting them at the rate of one every couple of weeks, and we've only got 9,000 out of 22,000 students vaccinated. I wouldn't be surprised at all to see an additional case, and that's why we're so eager to. We want the students to know that they're still at risk, and we want them to get vaccinated.
When you say the population is at risk, is the Eugene community outside of that also at risk, outside of the campus? Should people in Eugene and Lane County be getting vaccinated as well?
I don't think so, and it's based on sort of our general understanding of meningococcal disease, which, as I've noted, has been at very low levels in the state of Oregon in recent years. And in general, we also know that college freshmen living in dorms are at a particularly high risk. So we got an outbreak that initially involved all freshmen. It's following that pattern. We do have a couple of sophomores, and we have no delusions that the juniors and seniors are totally immune to it all. But we know that risk wanes quickly after you reach the age of your early 20s. So I don't think there's a general risk to the community. And we know that contact is likely most intense among the students on campus, as opposed to between students and the rest of the community. There are a couple of groups with rare immune deficiencies called complement component deficiencies, people without spleens, microbiologists who work in the laboratory with the organism regularly, for whom vaccination would be recommended, not only in Eugene but everywhere, but not for the general community.
I have a question. This might seem a little odd, but if you're one of these carriers who carries it but doesn't get sick, if you get the vaccine, does that kill it in your system? Are you no longer a carrier at that point, or no?
That's one of the reasons we're doing a study. The Center for Disease Control was in town for the week. I think you may have met some of those staff. We don't know the answer to that completely, and that's something we need to understand better.
In terms of Oregon Health Authority, can you kind of just classify for us how big of a priority is this outbreak for you? I mean, in terms of other stuff you're looking at or dealing with in the state right now?
Well, for the communicable disease section, I can speak anyway, and it's number one right now.
Working in Eugene, we're from K-Val, University of Oregon is our home turf. It doesn't seem like there's much urgency on campus. What will, you can't talk about the university on their behalf, but what will you do be stepping up the urgency? Like, again, we had, kids, I'm not going to get it. Some doctor is telling me to get this vaccine. I don't think I need it. What kind of urgency, what's the message for these students?
So there's multiple messages. I mean, we'll talk about one today. So we're having a clinic going to where the students are today in Eugene. You're probably well aware of it. We're going to have that clinic from 3 to 6 today. We're trying to plan more of those, and with appropriate messaging. So not just media messaging, but also visual messaging that you put up signs and such elsewhere where we know that students frequent and that they will hopefully see them. And we have had a lot of creative ideas from our public information officers. You'll probably see a few new things coming, which I'm not going to talk much about yet, but you'll see a few other opportunities for us to get the word out in a better way. And we'll see if it works. Each university is a microcosm in some ways. Some things work in some and don't work in others, and I think we're learning some of that now. And I hope that we're more effective at getting 15,000 people vaccinated as opposed to 9,000 plus.
There's been a couple of cute ads like Get the Vax and promos with athletes and student icons on campus. At what point do we say, all right, we need to do some mandatory vaccinations? I mean, we've already had a student pass away. We have now in the 6th confirmed case. At what point do we say we're going into the students?
That's a challenging and collaborative decision point. And again, dealing with personal autonomy, dealing with infectious risk, those are all thoughts that have to be dealt with very deliberatively. And we would certainly be working with the state on that and with the university as well. What are some of the histories where we've done that? Almost none.
Right. I don't see the scenario where we would go in and, as a state public health entity, mandate that students on some campus get vaccinated. So I don't see that happening. We're going to continue to try to use, everything else that we got to persuade them. And as you know, right now, I'm appealing to the parents who may have more perspective about medical things. Your students are at risk. They could come down with a really nasty disease if they're not vaccinated.
What was the fatality rate again?
7 to 10% overall, but then a significant percentage of survivors can have long-term problems. They can be rendered deaf by the organism if it invades the central nervous system. Students can lose digits because of blood clotting at the end of their extremities. It's one of the nastier diseases that we deal with.
A lot of states mandate new incoming students to either get a meningococcal disease vaccine or to get information about that, and that's mandated in state law. Has that been a discussion with lawmakers? I know they're in session right now. Is there a need for that, do you think, either of you?
Again, in general, the disease rates have been very low, and for the time being at least, we're not issuing a general recommendation for college students to get these vaccines, but we are very interested, because of what we know is going on the University of Oregon campus, that those particular students get vaccinated. A more targeted approach, if you will.
Dr. Luedtke, I know you're not the 6th student's primary care doctor, but can you kind of describe the circumstances where it was discovered he had this meningococcal disease, and did you notice some symptoms and go to the doctor, or kind of, can you touch on that at all?
So I don't know at all, unfortunately. Okay. I know how I was notified. I was in a meeting, which is probably not a surprise, and I got a flurry of phone calls. As I understand it, the student was ill, sought medical care. The provider was concerned enough to provide some therapy, some medication, and some watch and worry signs if these things develop, and had an appropriate blood test done, and the blood test was positive, and the student was brought back in because of that positive blood test and the potential risk going downstream. So there's a fork in the road when you get this bacteria where things can go bad really fast, and potentially the provider who saw this patient, and I called him up and thanked him, may have saved his life. He gave him antibiotics early. That may have been the right thing to do. So I think that from my standpoint as a health officer in the county, I'm pretty comforted that the provider community is hearing what's out there, hearing what to do, and taking safe measures to protect these people. 2 months earlier, that person may not have lived.
There's just simply no way at this point to know who or where the student got this disease from.
I think that's correct.
There's too many people without symptoms who are harboring the organism who you could come in contact with. I mean, for all I know, I could be getting it from you right now, Dr. Luedtke.
Or the other way around. Yeah.
Right. So there's just no way of knowing.